Hello, my name is Amber Drumheller. I'm a psychiatric nurse practitioner. I currently am enrolled in the DNP program, the Doctorate of Nursing Practice, at Maryville University. This is my scholarly DNP project presentation. Many concepts and definitions are important to know to understand this DNP project. Those concepts and definitions include mental illness, adversity, anxiety, depression, attention deficit hyperactivity disorder, or ADHD, and oppositional defiant disorder known as ODD. Mental illnesses are health, health conditions involving changes in emotion, thinking, or behavior, or a combination of these. Adversity is a very difficult situation. Anxiety is a feeling of nervousness or worry. Depression, also known as major depression disorder, is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Attention deficit hyperactivity disorder, or ADHD, is one of the most common neurodevelopmental disorders of childhood. It is usually first diagnosed in childhood and often lasts into adulthood. Symptoms may include being overly active, trouble focusing or paying attention, and increased impulsiveness. Oppositional defiance disorder, or ODD, is a disorder that typically develops during childhood. The child may have difficulty following rules or listening to individuals designated as authority figures. The child may not cooperate and may be defiant against rules. The cause of a child developing ODD is unknown. It is evident through research that many mental illnesses and behavioral issues begin in childhood and adolescence. Mental health illnesses can continue into adulthood. For most children and adolescents, children and adolescents may be unable to recognize that they are struggling with their mental health. This means that they will need to have supportive parents who can recognize the signs and symptoms of their mental illness. The prevalence of mental illness among children and adolescents is astonishing. One study suggests that 1 in 6 children or adolescents between the ages of 6 and 17 years old have at least one mental health diagnosis. If their mental health is not treated appropriately, they may develop physical illnesses, unstable emotions, behavioral disturbances, difficulty maintaining relationships, and addiction to drugs or alcohol. The main barriers that cause children and adolescents to not get mental health treatment include not having access to resources, family dysfunction, and being unhappy with previous mental health professionals. At an outpatient mental health clinic located in the Midwest region of the United States, patients were noted to have adolescents with high rates of mental illness and behavioral issues. To address this challenge, the author of this project implemented a quality improvement program using practice guidelines to improve mental illness and behavioral outcomes in adolescents 10 to 19 years of age. This scholarly DNP project was completed to evaluate whether adolescents had better behavioral or mental health outcomes after their parent or guardian attended mental health literacy courses. This writer used a quality improvement design when completing this scholarly DNP project. Descriptive and quantitative data was used to complete the project. A unique data collection process was necessary to collect the proper data to complete the scholarly DMP project. The Child and Adolescent Behavioral Checklist, the CBCL 6 to 18 parent version questionnaire was used to assess adolescents' behavior in pre and post mental health literacy courses. The CBCL 6 to 18 parent version questionnaire is one of the most used questionnaires amongst questionnaires that are completed by parents to assess an adolescent's behavior or emotions. The questionnaire was first created in 2013 as a standardized test, and it was made accessible to others for free. Its large standardization was created in 2017. The CBCL has 120 questions that are focused on a child or adolescent's behavior. The questions on the CBCL 6 to 18 parent version questionnaire focus on criteria that are listed in the Diastolic Statistical Manual 5, the DSM-5. The aims of this DMP project include showing readers how important it is for parents to receive education on adolescent mental health symptoms and illnesses. Education and awareness can help improve a child or adolescent's mental health by increasing access to mental health treatment. During this scholarly research project, quantitative research methods were used. Quantitative research methods are used to collect numeric data that can be analyzed statistically. After research subjects completed the pre and post CBCL 6 to 18 parent version questionnaires, this author compared the scores on an Excel spreadsheet. This was conducted in an unbiased, unobjectable manner. The next step was to complete a statistical analysis of the data that was collected. Due to a lack of participants, this author was unable to complete a statistical analysis. The Quality Improvement Scholarly DMP project took place at an outpatient mental health clinic in the Midwest region of the United States. Parents and guardians of adolescents ages 10 to 19 years of age who suffer from behavioral issues and mental health disorders agreed to participate in mental health literacy courses. This author had 50 participants that agreed to participate in this DMP scholarly project. When it came time for the mental health literacy courses to occur, only 2 participants attended. The mental health literacy courses took place for 1 hour every Thursday for 6 weeks. At the initial course, both participants signed the consent to participate form. Both participants filled out the pre-CBCL 6 to 18 parent version questionnaire before the course started. The NAMI Basics in Demand was utilized as the mental health literacy course content. At the end of the 6-week class, both participants filled out the post-CBCL 6 to 18 parent version questionnaire. Due to the lack of participants, this author was unable to complete a statistical analysis of the data received from the scholarly DMP project. Therefore, the data that was received could not verify that mental health literacy courses for parents or guardians were effective at improving the outcome of behavior on mental health disorders of adolescents ages 10 to 19 years of age. Facilitators is a scholarly Facilitators in a scholarly research project are factors that make it easier for participants to participate. Facilitators were identified during the implementation of the Quality Improvement Project. The scholarly DMP project was conducted in a neutral environment for all parties involved. The mental health literacy courses took place in the evening, which allowed parents or guardians to ensure that they had childcare for their adolescents after school. The mental health literacy courses were free for participants. Barriers are factors that keep participants from participating in a research study. One of the barriers to this writer's scholarly DMP project was that the project was conducted in a rural community. This provided a small pool of participants when searching for participants who met the project's inclusion criteria. A second barrier was that individuals who agreed to participate in the scholarly project had initially been seeing this author due to their mental illness. A third barrier was that the mental health literacy courses took place on a Thursday at 5 p.m. This means that individuals who were still at work or working a later shift were unable to attend the mental health literacy course. A fourth barrier was that individuals with younger adolescents who did not have childcare were unable to attend the mental health literacy courses. The use of quantitative data was used to measure whether mental health literacy education for parents or guardians of adolescents ages 10 to 19 who have a behavioral issue or a mental health diagnosis is effective at improving the adolescent's behavior or a mental health outcome. This author managed the data by entering pre and post scores into an Excel spreadsheet. The scores from the CDCL 6 to 18 parent version questionnaire were considered ordinal data as they have clear rank order but may not be evenly distributed. The nominal data is the CDCL 6 to 18 parent version questionnaires. The data was unable to be uploaded to the statistical package for social sciences, the SPSS. Descriptive statistics were utilized. However, the statistical analysis was not able to be completed. The CDCL 6 to 18 parent version questionnaire scores were supposed to be analyzed using the paired t-test analysis. The paired t-test analysis is used to compare two mean scores for related or paired groups. The paired t-test is an inferential statistical test that is used to determine whether paired or unpaired sample means come from identical or contrasting populations. The results were unable to be calculated in percentages. A priori analysis was completed, resulting in a suggested sample size of 41 participants or guardians who must attend the mental health literacy course. The participants for this project were females of varied ethnicities. Their ages ranged between 25 and 89 years old. Mental health literacy is what individuals know and believe to be true about mental health. One of the mental health literacy courses that are available for parents and guardians includes the National Alliance of Mental Illness Basics. They're also known as MAMI. Research suggests that this course improves family empowerment, improves how the family functions, improves family interaction with one another, and improves how one views oneself. It improves mental health literacy and improves how to accept one's emotions. The primary finding of this scholarly DMP project was significant to the lack of participants, was insignificant due to the lack of participants in the DMP scholarly project. It is undetermined if mental health literacy courses for parents and guardians of adolescents ages 10 to 19 years old demonstrated an improvement in mental illness or behavioral outcomes. Due to the small sample size, there was not enough data to complete a data analysis. Every scholarly research project displays strengths. Strengths of a scholarly research project may include discussions on practical applications, supporting evidence and validity of research. This first strength of the scholarly school project is that it has a clearly identifiable research question. The second strength that was identified was that the purpose of the scholarly project was clearly stated. The third strength noted was that the CBCL 6 to 18 parent version questionnaire that was utilized to assess pre and post changes in mental health and behavioral problems in adolescents is proven to be valid and a reliable tool according to multiple research studies. There are some limitations to this project. First, the project took place in a rural outpatient mental health clinic in the Midwestern region of the United States. The population is decreased when compared to larger metropolitan areas. The second limitation noted is that the DMP scholarly project contained a sample size of participants. It was recommended by statistician Dr. Powles that this scholarly project have a minimum of 41 participants. Due to unforeseen circumstances, this writer only had 2 participants participate in this scholarly DMP project. The implications that the scholarly DMP project could have on nursing practice are significantly large. The DMP project can be beneficial in the sense that mental health literacy decreases the stigma that surrounds reaching out for help when an individual is struggling with mental health. Mental health literacy courses provide individuals with information such as signs and symptoms that imply an individual is struggling with mental health. This allows people to get help from a mental health professional faster. Mental health literacy was first defined in 1997. Mental health literacy is what a person knows or believes to be true about mental health. Based on the scholarly DMP project, this author believes that mental health literacy courses could become a routine practice in the community. This author believes that there would be more participants in mental health literacy courses if it was marketed more efficiently. This author recommends a continuation of mental health literacy courses in the community would be beneficial to the organization where the research project took place and to the community that the outpatient clinic serves. This author believes that with a larger group of participants, this DMP project could be reevaluated for its effectiveness in improving mental health in the community. Here are my references. Thank you for viewing my presentation. I apologize ahead of time for any stuttering that occurred during this presentation. I have a traumatic brain injury. Thank you for viewing.